A 30-year-old woman is brought to the emergency department after having been stranded in the desert for 5 hours. Her temperature is 100 degrees Fahrenheit, 37.8 degrees Celsius. Heart rate is 105 beats per minute. Respirations are 20 per minute. Blood pressure is 100/60 millimeters mercury. On physical examination, she has hot, dry skin. Which of the following is most likely true of the patient at this time? Choice A, decreased water permeability of the renal collecting ducts. Choice B, increased firing of the carotid baroreceptors. Choice C, increased constriction of the efferent renal arterioles. Choice D, decreased prostaglandin activity at renal arterioles. Or choice E, decreased activity of pyruvate carboxylase. I'll wait 5 seconds and answer the question. So obviously this patient has heat stroke, but otherwise it's just a very straightforward physiology question, right? So this patient is dehydrated. So we know that in that setting, your body would try to continue perfusing your kidneys and maintain GFR despite the hypovolemia by dilating your afferent arteriole and constricting your efferent arteriole, the latter of which is primarily done through the RAS system, right? And of course you need to know that angiotensin II is a potent constrictor of the efferent renal arteriole. So choice C, increased constriction of the efferent renal arterioles, is the correct answer. Very basic physiology question, but it's always important to do a lot of these because it's easy to get these wrong through a careless mistake, right? So you always want to be careful about questions like this and read all the answer choices carefully. So let's just go through them. Choice A, decreased water permeability of the renal collecting ducts. So of course when I'm dehydrated, typically my ADH would go up and they would go to V2 receptors, which are GS coupled receptors on the principal cells of the collecting duct, which cause insertion of aquaporin 2 to reabsorb water from the lumen of the collecting duct, right? So the opposite would happen. It would be increased water permeability at the renal collecting ducts. And while we're on the topic, since I mentioned that these receptors are GS coupled receptors, there's a very easy way for me to make this question even harder, right? I could have put something like decreased CAMP or decreased protein kinase A in the renal collecting duct cells, and those would both be wrong, right? Because ADH agonizing a GS coupled receptor would convert more ATP into CAMP, which in turn increases protein kinase A, right? You always want to be aware of that autonomic pharmacology. So moving on, choice B, increased firing of the carotid baroreceptors. So that's the opposite of what would happen, right? If I'm dehydrated, I would have decreased firing of the carotid baroreceptors. What you need to remember about the baroreceptors is that they respond to increased stretch. Don't make the mistake of thinking that the baroreceptors are detecting things going either way. That's a mistaken way of thinking about it. The baroreceptors detect increased stretch and will respond to that by decreasing sympathetic tone, decrease heart rate, cause vasodilation, etc. Like I said, the main thing you want to remember is that baroreceptors respond to increased stretch. So they fire more often when you have increased stretch through hypervolemia or high blood pressure or whatever it might be. Okay, next, choice D, decreased prostaglandin activity at renal arterioles. Now, as I already mentioned, you need to know that when you are dehydrated, your body will try to continue perfusing your kidneys and maintain GFR by dilating the afferent arteriole. And you need to know that prostaglandins cause dilation of the afferent arteriole. So it would be the opposite of this, right? If anything, you would have increased prostaglandin activity at the renal arterioles. And of course, a favorite question of the USMLE is testing you on acute kidney injury that can occur via the simultaneous use of NSAIDs and ACE inhibitors, right? Because of course, NSAIDs inhibit prostaglandins, which means I have less afferent arteriolar dilation, and ACE inhibitors inhibit angiotensin converting enzyme, which of course creates angiotensin II, which, as we already mentioned, is what constricts the efferent arteriole. So if I can't do either one, that can result in a pre-renal azotemia. My GFR will go down. Just doing a basic pharmacology tie-in here because that does come up pretty often. So finally, choice E, decreased activity of pyruvate carboxylase. Basically just kind of an unrelated answer choice here compared to the other ones. I threw this in here just as a connection to biochemistry that you should be aware of, because another favorite question of the USMLEs is they'll give you a similar question about a patient being stranded somewhere or they haven't eaten in a while, and then they'll ask you about the biochemistry of which enzymes are increased and decreased in activity during this time. And pyruvate carboxylase is what's used to convert pyruvate into oxaloacetate, which can further be converted into phosphoenolpyruvate via PEP carboxykinase, which is for gluconeogenesis. So of course, this patient, having been stranded in the desert for 5 hours, maybe not long enough, but theoretically, if anything, she would want to be going through gluconeogenesis. So if anything, it would be increased activity of pyruvate carboxylase. This is just here as a reminder to all of you that you should be familiar with glycolysis and the various things pyruvate can be converted into. Pyruvate carboxylase is the one I like to mention the most because that one's probably the most confusing one, because the conversion of PEP into pyruvate is irreversible. So in order to get pyruvate back to PEP, I have to first convert it into oxaloacetate and then convert it into PEP if I want to undergo gluconeogenesis. Anyway, bring it back. Like I said, this is a very basic physiology question, right? But like I said, you gotta master your basics here. Not only because you can't afford getting these kind of questions wrong because they're easy, but also because you need this foundational understanding in order to solve a lot of the harder questions too. I hope you found this video helpful. I'll see you in the next one.